is it safe for women to do physical therapy? Because what you're saying feels as if like the way that I'm receiving it is like the woman is about to give birth and this particular woman has never had any support by someone like you, and she's in that stage.
Mm-hmm.
If me doing that before to prepare for that, wouldn't that induce labor? Like,
oh, that's a great question.
To me, that's like scary because I don't know, and I don't want to do I don't want to do something that is going to put me in that, like preparing myself to do that. And then it's like, oops, baby's coming, help.
Yeah, that's a great question. So I love this because if we could induce labor, our lines would be wrapped around this building. Inducing labor, helping a woman start the labor process, completely out of our realm.
Okay.
We can support her in being prepared for when that event does start. But touching the pelvic floor, massaging it, teaching her pushing strategies, none of that has been shown to start labor.
Okay, perfect.
Yeah.
Because that feels like...
Yeah. Oh, and you're not alone. Yeah. A lot of women will ask that. Like, oh, I'm only 36 weeks. Should I start birth prep because I don't want to go into labor? Absolutely.
Okay.
And like you'll be really asking us to help you start labor at 41 weeks and we'll still say you can go to acupuncture, you can have sex, you can do nipple stimulation with a pump. Like there's things that you can do that have been shown to start labor. That's not us.
Okay, good.
Yeah.
But it does prepare women physiologically to get those muscles like activated, or I don't know if that's the right word.
Yeah. Yes. So we rehearse for the big event. We really do. So we set the bones up for proper movement capacities. We set the muscles up to be flexible and strong and to have the right coordination for bearing down, for pushing, for relaxing. Like a lot of birth is a surrender process. So like they should be able to know how to connect to their bodies and release their pelvic floor. I mean, you talk to any birth worker and they will tell you it is a common thing for women to tighten their whole body with contractions, with position changes. So if you can even just rehearse that, and she can be in the moment and be like, oh, this sucks. Wait, I know. Let me breathe. I know it's going to suck, but I'm going to ride this wave instead of pushing against
Fighting it.
Yeah, it's training. It's training. I mean, we compare it to, like, we've worked with women who've run marathons, and we can prepare them for that. Not a single one of them has said, oh, but you've never been to the Disney Marathon, Kat, so you can't prepare me for that. Or like, you don't know what the weather's going to be like, so you can't prepare me for that. Or like, I need to buy shoes. I don't have the right shoes yet. Maybe I shouldn't train. What? No, you're going to run a marathon. Like, start running today.
Yeah.
And granted, did you know, like, typically, if you're preparing for a marathon, you don't run 26 miles every week. There's a path to it. It's like a 5-mile day, and then a 10-mile day, and then a 13-mile weekend, but then a 2-mile day, right? Like, you pace yourself. So even though you're not truly going through every single motion that you would do in your delivery, and there's a lot of factors that you don't know about, you can still train, and you should.
That's such a powerful thought. I have never thought about that in that way. Like, I'm just having like an aha moment as you're saying that. Like, why didn't I train for this?
Yeah.
Why haven't... It's like, your body knows. Don't worry. I'm like, I don't know about that.
Right. You're like, actually, I had a long conversation with my body, and it doesn't know. It doesn't like the idea.
I don't know about you, but yeah. And so then what I'm hearing you say is being able to do physical therapy can help your muscles create some awareness so that when the moment comes, even if you have a C-section or a vaginal delivery, you're less likely to leak after that. Is that a true statement?
Yeah, absolutely. Absolutely. Yes. Even just on muscle connection alone. So we do prehab for other surgeries fairly routinely. I mean, oftentimes patients will come to us if they know, not painless pregnancy, but back when I worked at the hospital, if they knew they were going to get a knee replacement, they would go in and get a little therapy. Oh, this is what it looks like. This is what it feels like to straighten my knee, to bend my knee, to da-da-da-da. and they have better outcomes post-surgery.
Wow.
Yeah. It's like a standard thing. So if you wait to connect to your core until you have a cut from your skin to your uterus, you can see how that would be not ideal.
Yeah.
Like you're cutting through nerves. Nerves are what help you be connected to your body. So do the core training now, before pregnancy, during pregnancy, so that after you have that massive surgery, you don't need to rely on sensory input, but you can rely on motor memory. And you can engage your core just by thinking about it, even if you can't feel it, it's swollen, it hurts.